Hello, everyone. This is Andre from the Mental Health, and I'm here with Carmine and Jonathan. I'm going to ask them to introduce themselves. We're going to talk about involving people with lived experience in research. So, Carmine, Pariante, do you want to say hello?
Yes, hello. I'm Carmine Pariante, a professor of biological psychiatry at King's College London, at the Institute of Psychiatry, Psychology and Neuroscience.
I'm Jonathan Rogers. I'm a clinical lecturer, psychiatrist at University College London.
So, you're both running a session later on today at the BAP meeting here in Birmingham on involving people with lived experience in research. It's a trainees workshop, a couple of hours. You've got all sorts of speakers. Do you want to just give us an overview of the aims of that session and what you're trying to achieve?
I'd love to. I think there are two things we're trying to get at. First is to show how and explore how the BAP can foster more lived experience involvement. And the second is to show early career researchers how actually involving people with lived experience doesn't need to be a scary thing. It doesn't need to be something that you only do when you've got a £5 million grant. Actually, it can be something that we're all doing as part of our research and how to go about that.
And when we say involving people with lived experience in research, we're not talking about involving people as participants in studies. We're talking about working with people with lived experience to co-produce research. So say something about why that's important, Carmine.
Yes, absolutely. So having people with lived experience involved right from the beginning just makes better research that is more clinically relevant. It addresses the questions that are important to the people that we're trying to help. It gives idea and suggestions and point of views that otherwise we simply wouldn't have as a scientist. So it's just a way to make research that is better and more relevant for everybody.
And I guess a lot of the science that is presented here at BAP is basic science. It's animal studies, it's molecular biology, it's all kind of neuroscience work. Can we involve people with lived experience in that kind of research in the same way that we can in a qualitative mental health study?
I think that's a really good question. And I think lived experience involvement hasn't been as embedded into preclinical research. I think it is still important, though, as Carmine mentioned, in terms of setting these priorities. So if you know what's important to patients, you can then work backwards to think what science do we need to address that.
So how do we do that? How do we find out what's important to patients?
We talk to them. We have we involved them in the project right from the beginning. In the BAP, we have a range of research going from basic science all the way to clinical psychopharmacology and psychopharmacological intervention. And I think every aspect of that research can be enriched by having someone with lived experience on board. Think also about even for the more molecular and basic science research. So think about how someone with lived experience can really help us frame the conversation about what we're doing that research, what do the finding means, bring that to the public and to the patient's community in a way that really makes sense to the broader community. And I think the key is having people involved right from the start. Sometimes people that have been previously involved in research at a personal capacity, and then you have built a personal report as part of a study project, and they want to stay on board and maybe help you with the next project. Different strategies work for different kind of projects.
And I guess as the mental health, I've been to lots of conferences over the last few years, over the last 15 years. I've really seen this growth of this lived experience work and co-production work. We're seeing much more people with lived experience giving keynotes, meaningful involvement at events. That's not so much something that's happened at BAP over the years, I don't think. Is that part of this, do you think, platforming lived experience more as a key part of the event?
Certainly, we are now having advisory board of people with lived experience. Is really thanks to the guidance of the current or almost president until literally this conference, Professor David Baldwin, who has inspired and put together the advisory board of people with lived experience that also have a representative in the BAP Council, so basically in the governance organization that takes all the most important decisions. So we're doing the steps in the right direction, absolutely.
I'm a clinician, and when I see a patient later this week, some of the science is going to be a long way removed from that, but I still think it's fantastically important to be developing the treatments for 10, 20 years' time, even though it's not going to affect what I do later in this week. And secondly, I think that there is a gradual involvement of people with lived experiences. And let me give you one example of how it's affected me in the BAP. So I led out the BAP's guideline on catatonia, and for the first time we had someone with lived experience on the panel there. And it made a huge difference, actually, and brought up points that none of us as clinicians had thought of before. So I think it's having quite a tangible effect on what the BAP is doing.